very caregiver dependent or nonverbal children will probably go to that one, and then the other breakout will be for individuals who are on more of a career track, and so we kind of design speakers in that way. The other thing that we've done today is we've really built panels, and you'll see, I think if you add it up, there's about 40 or 50 really good speakers that are going to be here today. But we wanted this to be very informal so that you felt comfortable asking questions. Really, you guys are the experts, and so if you hear something and you're like, hey, that's actually been updated, or this is some more helpful information, then please feel free to share and give all of that information out as well. Ask questions. Movement is fine. We know on a big day like this, especially when we haven't been doing a lot of conferences, that sitting still for 8 hours can be tough, so movement is fine. And again, we really want to emphasize seeing the vendors. This is my friend and colleague here, Mary Roth, so I'm going to hand it over to her now.
Good morning. I'm Mary Roth, and I'm the Director of Adult Services here at Untitled, and we want to welcome you to what we would love for you to think of as one of your home away from homes. We serve folks from birth throughout their lifespan, so we want to be here for you during that hard transition time, and we're just so excited that UAB asked us to partner in hosting this event today. So we do, like Betsy said, we want this to be very informal. We want this to be a conversation. We're going to have panel set up instead of just a speaker, just talking at you. We want you to ask questions. We can come around with the microphones during presentations if we need to. Just a little bit of housekeeping piece. We do have 2 personal care suites, one on each side of the back hallways. They're ready for anyone who may have a need as a caregiver. There's also restrooms in both of those suites. Down this hallway right here to my right, there's also men's and women's restrooms. We have lots of snacks out, so like Betsy said, movement is great, so just kind of come and go as you please. I think I'm going to get this good. I'm going to walk around quickly and let the vendors, okay.
Yes, so we want to provide.
Yes, breakfast is provided, so if you want to get breakfast, maybe after we do our little talk, we might have a second to kind of pause and let folks do that. So I'm going to walk around real quick and let folks introduce as vendors. This is our Unitability table. We have several folks that will be here to answer your questions throughout the day about all of our services. And here we have...
Hey, I'm Robert Lee with the Exceptional Foundation, and we provide a full range of life experiences for children and adults with intellectual disabilities. We have summer camp for children 5 and up, after-school program, but we have year-long day programs where we play sports and field trips and do just all kind of fun, amazing things. Happy to be here.
Hi, my name is Chandler. I'm in Family Voices of Alabama. We provide connections for families with resources. We do provide some mail-out resources and parent-to-parent connection based on your special interest or need.
Hey everybody, I'm so impressed we've got so many people here today. This is wonderful. I'm Jenny Rediker. I'm with Children's Rehabilitation Service, and so we will serve children 0 to 21 with special health care needs. I'm also one of the presenters today, so I look forward to answering any questions anyone has, and I hope you all have a wonderful day.
Hi guys, I'm Lisa Lee. I'm a vocational counselor with the Alabama Department of Rehab Services, the Vocational Rehab Service. I'm here with my colleague, Tamika Ann Wilson, who is a specialty transition counselor for the Birmingham area. We're really excited to be here with you guys today. We have lots of good information about transitioning to employment for teens and adults.
Good morning, everyone. I'm Bob Cornelius, law firm Cornelius and Talley. We are special needs attorneys. I stepped aside from the corporate world about 2005 or 6, and all I've done since then is special needs and elder law. Now, nobody's necessarily seniors, but elder law and special needs law coincide pretty much. So, been doing this for 43 years, and glad to be back, and I'm glad to still be doing it. Thank you very much for coming to see me.
Good morning. My name is Andrea Nixon. I'm a senior staff attorney at the Alabama Disabilities Advocacy Program. It's so good to see all of you today. I'm also serve as the children's team leader, do a lot of work in transition related to special education, Medicaid waivers, VRS, Social Security Ticket to Work program. So please stop by and introduce yourself and let me know how ADAC can help you. Thank you.
Hi, I'm Cindy Wheeler. I'm with M4A, the Middle Alabama Area Agency on Aging. We do the Medicaid waivers for a lot of the kids. We connect with resources. We do a caregiver program. We have the prescription assistance programs, and we go out, Annette and I go out into the homes, and we talk with the parents to see what you're going to need, and we'll connect you with resources. We'll come see you every month and aggravate the tar out of you. But we love our kids to death, and we're really excited to be here.
We also see seniors.
Good morning. Good morning. My name is Ben Peters. I'm with Mobility Central. We are a local DME provider that specializes in seating and positioning as well as home modifications. We are in Vestavia here in Birmingham, small business owned, and we do have a showroom where if you do need anybody to stop by and take a look at a product before they make a selection on anything, we have about a 3,000 square foot showroom that people can stop by and take a look at stuff. We also do service and rentals on any equipment that you can get. So if you'd like to stop by, I've got a lot of information here for you guys. So come by and see me at some point this morning. Thank you.
Good morning, Doug Prater with A&A Home Health Equipment. We do home medical equipment as well. Specialize again, I've been in the assistive technologies side of things. I'm an ATP as well as being. We're out of Trussville, Alabama. We service children and adults, and pretty much from Montgomery to Huntsville. So come by and see us, and we'd love to tell you about it.
Never talked in the mic before. My name is J.C. Williamson. This is my colleague Shannon Graham. We're with Workshops in Empowerment in Birmingham. I work with high school students. Most of what I do is work in schools and teach classes designed to help kids transition from school to the world of work. And we also host a summer of work program where we partner with area businesses where they're able to take the stuff they learn in class and put it into action through real life work experience. And once they are out of high school, Shannon here helps them with job placement services.
Good morning, I'm Susanne Stewart with Little Life Ahead, and this is Nicole Collier. She's one of our family advocates. We work with teenagers, young adults, and their families to help discover and make living full lives a reality. So we work with the entire family all year round, but 3 times a year we have family camps. We've got one coming up in July, so we'd love to tell you more about that. But it's a weekend where the entire family comes and to Children's Harbor on Lake Martin, and we have a great time, and we also learn and we make great connections. So I'd love to tell you more about that. So we're glad to be here this morning.
I'm Josh Whitmire. I'm with Disability Rights and Resources. I've been with them for all told almost 9.5 years. We do a lot with independent living skills and consumer-based services is basically how we work. Is what the consumer expresses that they want to do. That's basically the goal that we set for them. We work out of a 20-county service area from state line to state line, Shelby County to Etowah County. That's really about it. It's just we do a lot with youth and young adults, and we are a cross disability organization, and we don't have an age restriction. It's just basically if you have a need and you have a disability, you can come talk to us, and then we'll take it from there.
Good morning. I'm Jennifer Rucker, and I'm representing People First of Alabama. I am the Shelby County Chapter Advisor, and People First is a national organization, and we have chapters across Alabama, and we would welcome you to stop by our table to learn more about how you can help empower, engage, and educate our individuals with disabilities to become better self-advocates. That's what People First is all about. Their motto is, nothing about us without us. One of the things that I would like for parents of young adults or teenagers, those in the transition ages, is to consider and come by and pick up information about our Young Emerging Leaders program. This particular facet of People First helps train our older teenagers and young adults to really get involved with advocacy. They have leadership meetings, community resource fairs, just a variety of things. We have an opportunity coming up at the end of this month at Oak Mountain State Park, social activity on team building for persons with disabilities. So if any of you have children who fall within that category, please stop by, put your name on the list, because we would love to invite them to this opportunity. We also have a great handbook here that I invite you to look at, which tells a little bit more about the Young Emerging Leaders program. Thank you.
Hello, my name is TJ Madeline. This is Jason Winston with National City Mobility. We are a provider of complex rehab technology for seniors, wheelchairs. For those who have a permanent need, and should you or a loved one have a need, we hope that you give us the opportunity of your business.
All right, so I'm going to go ahead and introduce our first session of speakers, and then while they're getting set up, give you guys a few minutes, if you didn't grab breakfast, to go grab some breakfast, and then you can sit back down after that. I also wanted to remind all of you that Alabama Cares is here today, and they are Facebook live streaming this, and so we're very fortunate for that. But if you have anybody who you're like, man, I really wish so-and-so could hear so-and-so, you can text them real quick and say, hey, jump on Facebook and listen to this, or it'll be posted on their Facebook page afterwards, and so you can send them on over to check that out. Okay, so if our first panel can come in. All right, so I'm going to introduce Dr. Carlie Somerville and then let her introduce the rest of her panel. So Dr. Carlie Somerville, or Carlie Stein, written in a lot of places, is the medical director of the STEP program. She is absolutely wonderful, and it's really because of her vision and passion that we were able to build the transition program that we have. So it is definitely my honor to introduce her to you guys today.
All right, thanks, Betsy, and thank you. All right, so kind. So excited to see all these beautiful smiling faces, so many, maybe not old friends, but several years worth of friends, and several new friends, and exciting people to meet today. So we have been talking about this for so long, and we are just so thrilled to be here today. We're so thankful to United Ability for this beautiful building and space that we can all meet together and hopefully learn from one another today. So I have the huge honor of moderating this incredible panel of people behind me. All of these fabulous medical providers, physicians, nurses who work in a lot of the medical settings where many of you are seeking care right now or hoping to learn more about. And so I am going to start by just letting each of these folks introduce themselves, tell us a little bit about the medical practices that they work in, and then hoping that each of them will share a little bit about their passion for the medical work that they do, but then also give all of you a piece of advice as you go through that medical transition piece based on what they've experienced and the patients that they've cared for. So I'll introduce myself a little bit more and say my answer, but as Betsy said, my name is Carlie Stein Somerville. It gets a little confusing. Some people call me Dr. Stein, some Dr. Somerville, and some even in clinic will say, I thought we were seeing the other name today. So you might hear both names from different people. I grew up in Birmingham, Alabama. I'm a Birmingham native. My grandfather actually was born in Birmingham, so third generation, and that has been really special for me growing up where my family is from, and then did my medical training all at UAB, did my residency training in internal medicine and pediatrics. So I am double board certified, work at Children's and can take care of children as a pediatrician, and then also as an internist at UAB and take care of everybody 0 to 100 in my everyday practice. And then really in that experience for me was where I really started to notice this huge gap in the care for my patients as they aged out of Children's. And lucky for me, as a med peds provider, I really didn't have to transition anyone away from me, but that's just not true for so many of you, and really the majority of patients as they move through the system. And so for me, it was very clear in the things that I saw that we needed to do better from a transition standpoint. We really needed that clinical landing zone for our patients when they turned 18 or 21 to have a smooth transition and to have a medical home in the adult world. And that's what really led to me really talking with stakeholders at Children's and UAB, and luckily being introduced to Betsy and finding this incredible team of people all around me and so many others who couldn't be here today. And that's how we've developed the STEP program. So super excited to be here and talk with all of you individually later, but I'm gonna hand it over to each person up here and let them share a little bit about their story, and then hopefully we'll have time to just answer up to questions, because certainly we want to hear from all of you in ways that we can help you and answer questions about things you're struggling with in the medical world. So we will start over here.
Hey, I'm Deanne Lenzie, and I'm the nurse clinician here at the Ability Clinic. And we have a kind of a unique perspective here. We serve persons with disabilities and their families from birth until you don't need us anymore. So I guess my one piece of advice for you guys would be to just take a deep breath and look around you. You've got medical professionals, and you've got friends, and you have people in your community that can help you every step of the way. So just reach out to us. We're here if you need us.
Hey, good morning, guys. I'm Julie Baker. I'm a nurse with Dr. Danielle. I'll you guys get to meet her in just a second. So I was a pediatric nurse at Children's for about 10 years, and then joined the UAB rehab team about 4 years ago now. So I kind of transitioned with my patients, that's what I like to say. So I'm the adult on benefit coordinator there, so get to see a lot of friends that I took care of at Children's, now in the adult world. We also come over and work with Ms. Deanne once a month typically in the adult clinic here. And my one piece of advice would be, since Deanna took the take one breath, I thought we were going this way, so I can steal Deanna's line. Don't be afraid to voice your fears and your concerns and have those validated. And it's okay to let your providers know that, what you're really worried about deep down.
Good morning, everyone. My name is Dr. Danielle Powell. Julie already kind of introduced what I do, but I am a physical medicine and rehabilitation physician. So I want to give you a little background on kind of why I chose the specialty that I'm in. So when I was in high school, my grandmother suffered a stroke. And I remember seeing my grandmother, who was kind of the backbone of our family, help me throughout my whole growing up, encouraged me in everything that I tried, become someone different. And at the time, I knew nothing about my specialty. All I knew was that this woman who I loved now was in a wheelchair, could not walk. And because my mom was my parents were divorced, but my mom took care of my grandparents, it got to the point where she was no longer able to take care of my grandmother, and we had to transition her to a nursing home. And I just remember going to medical school and meeting patients that had similar strokes as my grandmother, and always wondering, there has to be something, there has to be someone that can help these people obtain a better quality of life. So as I started looking at specialties, I came upon physical medicine and rehabilitation. And it was just like this epiphany, like this moment just happened for me that I was like, this is what I want to do with my life. I want to help individuals have the best quality of life possible, to not just exist in this world, but be able to feel like they're able to give and that they can actually exist and have the best quality of life possible. So that's why I chose PM&R. But with what I do now, so as Julie kind of stated, I am the director for the Spinal Bifida Clinic, adult clinic at UAB. I also come over here to Link Point once a month and see various disabilities. And then I also attend the STEP clinic, which I'm so glad that was started because there was a huge gap in the primary care that patients that I would see, they didn't have a good primary care physician. And this clinic has changed a lot of patients' lives. So the one advice that I would give you is I would say never give up. We don't have all the answers, but I'll tell you that everyone on this panel, we are committed, and all of the vendors that you see today are committed to try to help you as much as we can and to help with you finding a solution. So I would say just don't give up. Always advocate for yourself. Always advocate for your loved one. And just know that you now do have people that care and that want to be a part of your family in a sense.
Thank you. Hello everyone, I'm Beth McGee. I am the RN Clinical Care Coordinator for the STEP program. I have been a nurse for 15 years, 14 at UAB. And I found my home in the STEP clinic back in October. And I absolutely have fallen in love with it. And my biggest piece of advice would be, as we've already talked about, is don't be scared. When you call us or I call you to schedule that first appointment, tell me what your concerns are. Tell me what you're afraid of. And I can pass it along to this wonderful team that we have, and we can work through it together. You're not alone in this situation.
Okay, hey everyone. My name is Madeline Eckenrode, and I'm a med-peds physician like Carlie, so board certified in internal medicine and pediatrics, and provide primary care in the STEP clinic. And I love med-peds because I think I really believe that individuals aren't just patients. They are, daughters, sons, brothers, sisters. They exist in a wider community, and we need to kind of take every person's kind of context into consideration when providing medical care for them. And so I love that we do that in the STEP clinic. We consider kind of social, kind of emotional, and medical kind of issues when we're seeing our patients, and that's very important to me. I guess the piece of advice that I would give is that everyone's transition is individual, and it can be as kind of slow or as fast as you want it to be. At STEP Clinic, we want to kind of recognize that, acknowledge that, and kind of help you have the transition that you want to have. I hope that we're making it a less scary thing for people. I guess, are we opening up to questions or?
Yeah, we can open up. Betsy wanted me to remind everybody, please go get food. It's right all here. I think she promised when she was speaking that we would give everyone a chance to get up and go get food, so you're not being rude if you stand up and want to go eat something. I think the only thing I thought about is, for those of you who don't know what STEP program is, I'll give like a little bit, just more one-liner about what we do, because certainly there are folks here who've never heard of STEP program, so what is that? So STEP program, we opened our doors about 2 years ago, despite conversations starting many years before that. But it stands for Staging Transition for Every Patient. And that, like Madeline said, is a primary care medical home at UAB. And so who can come to that clinic? We get that question a lot. We really wanted to keep it as open-ended as possible. So what we say is that anyone 18 or older with any disease of childhood who needs help in any way making that transition to the adult medical world, we are excited to see you and help partner in that journey. We really wanted to make ourselves available to anybody, and that really includes anybody around the state, any insurance, no insurance, multiple insurances. We really wanted to reduce barriers to care for our patients because we know that there isn't really a resource like this really in our state, and very few, if any, around even the region of Alabama Southeast. So that is really anyone who can come to our clinic. What happens in our medical clinic? So first visits can be really long. It's really meant to be, like Dr. Eckenrode said, an in-depth look at what are your medical issues, what are your medicines, kind of getting all of that moved into the adult medical system, but then also really getting to know your family. What are your fears? What experiences have you had already in the health system that may have been negative? And so a lot of it is really just listening and getting to know you and your family and making sure that we have the best sense of how we can help you. Because what we honestly find is a lot of the time, it's less medical help that so many of our families need, and more of our patients really need more of a comprehensive look at resources and what are we going to do when we graduate school, and how are we going to get a job, or how are we going to get into a day program. And so there are just so many pieces that go into that. And luckily for us, we are so fortunate. We have CRS here today who from the beginning have been present in our clinic. We're so grateful. We have anywhere from 1 to 3 to 4 social workers with us, and honestly, I always say that they're the more meaningful part of our clinic than the medical staff, because they're just such a wealth of knowledge and resources for all of us. And then we're super lucky, we actually have a physical therapist who's with us in clinic too, to help with any sort of equipment resources or connecting to physical therapy resources in the community. And then many of you know, like Dr. Powell and Julie said, we're really fortunate that anywhere from monthly to quarterly, we have a lot of specialists who come to clinic with us. So every month, we have monthly now, right? So monthly, we have Dr. Powell and Julie coming with us to have really coordinated visits for our patients. And then we also have a neurologist who comes to clinic with us, Dr. Bowe. We have a neuromuscular specialist, Dr. DeCampo. We have a renal transplant doctor, Dr. Ong, who's been coming to clinic with us. And then we have a lot of close ties with other physicians and other departments and divisions, including pulmonary, who Dr. Barney, who comes to see patients when we ask him. So what we really tried to do with this clinic is almost model some of those multidisciplinary clinics that many of you are used to at Children's, right? If I'm going to drive from all over the state and all the barriers that can come up to just getting to the doctor's office, right? Everything from things that happen in life to where am I going to park when I get there, it can be just so challenging for our patients. And so what we really tried to do is have as many resources as possible in this one clinic setting, and to coordinate that with the amazing help of our nurse Beth, because as you can imagine, there are a ton of pieces to that, making sure that all those right people are in the clinic on the same day to see you all when you need to be seen. And I think that's one of the greatest strengths that we have to offer, and we're in talks with a lot of other specialties. The word is spreading and people want to come work with us. We have some really positive talks about having an endocrinologist start coming with us in the fall. And so we really look to each patient and what your barriers may be and what your individual needs may be. And we're committed to finding the right people to come into this clinic space and make it as easy as possible for all of you to access your medical care. So that's a little bit more about STEP program. And I think now it'd be great to go ahead and just open up to questions, and then we'll let our panel speakers answer and help talk you guys through anything that we didn't answer already or might be struggling with. I'm going to see if I can.
I'd like to give a step.
All right, lovely. Sure. We have a fabulous okay, perfect. Thank you. Thanks, Mary. So yes, we have a request from the front row. Jill Billions would like to give us a clinic testimony about her experience, which I really appreciate that.
I don't talk in front of people, and I'm really sorry I had brain surgery. I don't use my words, but my daughter Autumn, she's laughing at me. She will be 39 next month, and so I know what it's like to transition. And for anybody that hasn't done it, at least the way it happened for us was you saw the pediatrician until you couldn't see the pediatrician anymore, and then you try to find a doctor. I mean, we were lucky enough to have Dr. Crane, which, I mean, he was just great because he's fabulous, but then, you know, he stopped seeing patients in his office. But we ended up seeing specialists that would be okay seeing this handicapped person, but really, because they were being polite, but they really didn't know how to deal with her. And because she's small, she has like a pediatric size, you know, feeding apparatus, and they would be nice, but when things really went wrong, they weren't comfortable. And we had to get specialists at all different areas and go all around town. And nobody was ever really comfortable with it. And so her care was never very coordinated, and it was always difficult. Sometimes we'd have to plead with somebody to see her. So when I found out about the step clinic and we went there, oh my gosh, I'm going to cry again because I'm sorry, I'm a doctor, and I felt like I'm a medical doctor. We're both medical doctors, and I felt like there's this big, there needs to be a specialty or something. There's this big space that's missing. Somebody needs to know how to take care, because honestly, there's all kinds of great stuff for kids, but when they grow up, stuff falls away, and they don't look at you the same. And then somebody told me about the step clinic. It was Bob's endocrinologist stand-up. So we go there, and I meet Dr. Somerville, and we see the doctor that understands everything about her. We see the rehab doctor. We get an appointment with, we see the social worker that starts talking to me about all this waivers, and gets me directed on stuff. It's been years since anybody's talked to me about this stuff, and a lot of things have happened that are new that I don't know about. We get an appointment with the neurologist that, says, oh, well, a lot of regular doctors don't know about, there's other changes we can do. We see all this stuff, it's all done at one time, they all talk to each other. It was like a dream come true. It's all at one place. It was magic. I was like, I've got to tell everybody about this. Everybody needs to know about this. It's what we've been waiting for. Don't stop home, go sign up, this is what they need. Anyways, that's where I stand. Thank you guys for what you do.
Yes, my son goes here, and he's the youngest one here. Because he's 20, I did not want him to stay in high school and just go to high school. I wanted his life to move forward. But anyway, he loves it here. He loves it here. My question is, I think to that, he will be 21 in September, which means he's coming out of his pediatrician. And he's seen her since he's been born. And she has given me a couple referrals, but I wanted to know for you, do you work on referrals? Do we need a referral?
We can
for
talk.
Your assistance?
Yes, ma'am.
I'm sorry.
Yes, ma'am. We can talk, and I can get your information, and I can call you next week, and we can schedule something.
Okay. And is there a terrible waiting list?
Right now we are scheduling, which I know we're talking about possibly opening some afternoon clinic time. Right now we only meet on Wednesday mornings. Right now we are scheduling end of September, 1st of October for new patient appointments. But hopefully as we open up these afternoon spots later on in the summer, early fall, we can get people in a little bit sooner.
Okay, because he will turn 21 in September, but his last appointment with his doctor, his pediatrician now, luckily is in August. so we can get through that gap, but I will need a new position for him.
Yes, ma'am. I'll get you my contact information and we can talk this week coming up and get something scheduled.
And once again, you said all insurance, no insurance, he's on Medicaid, of course. So we're cool with that.
Yes, ma'am.
All right, then, girl. Thank you, Beth.
I just have logistics questions. How do you refer, like from a case management standpoint, how do you make a referral and where do you meet and what's the number to call?
Okay, so I'll just go ahead and give you my direct line. Pull out phones. Yeah, everybody get your phone out. It's 205-731-9676. There is also on the UAB, like the UAB website, if you can just Google like UAB referral, and there's a website called Refer a Patient, and you can do it, providers can do it, patients can do a referral for themselves, parents can do a referral, and it's a really easy form you fill out. You just fill in the information. The biggest thing is, I just need a good phone number and who I need to speak with regarding the appointment, and it's simple as that. We meet in the Whitaker building at UAB. So we're adjacent to Kirkland Clinic. We're on the opposite side of the Kirkland Clinic parking deck from Kirkland Clinic. And I've got some flyers that has the address and everything on it if anybody needs those.
Anyone else?
Are area pediatricians learning about this? Are you trying to get the word out as quickly as you can? I'm sure, but just a word on that because so many families are looking.
Yeah, that's such a great question. So we have a lot of efforts going on at Children's and UAB. So we've really, I think, like I mentioned, when we started to look at what the biggest gap and barrier was, the first thing was there's not really anywhere to land. So we really need this landing zone clinic for people to have to go to. So a lot of our first effort was in building the STEP clinic, but some of how we were able to build the STEP clinic was by surveying all of the specialists at Children's and physicians at Children's, saying, how do you think transition's going for your patients? Do you feel comfortable that your patients have somewhere to go and that you know where to send them? And to no one in this room's surprise, many of our pediatric specialists said no, we don't feel like we know where to send them. We had a lot of people, we had everybody rated 0 to 10, and there were numerous specialists at Children's who gave their programs anywhere from a 0 to 2 on feeling like they even have the resources to know how to help their families transition. And so that helped to make such a glaring, obvious case to UAB and to Children's that we need to support the development of this clinic. And now we need to go back and look at how are we preparing our families to transition? So there is a ton of work going on at Children's, all to the credit of Betsy Hobson right here. She has really worked hard to approach this from a systems level. I mean, it really can't be just like one doctor or one social worker or one division at Children's. It really has to be top down. This is what we expect all of our doctors at Children's to do for all of our patients when they turn a certain age, that we should start having these conversations and that we should all know the resources of where to send our patients based on the needs they have. And so much goes to the credit of Betsy and this team and so many others who are really helping to develop this at Children's. And then I think the other piece is just at UAB also identifying all of these amazing adult specialists and providers who are comfortable and want to learn and want to help care for our patients. And that has also been really exciting and promising. There has been no lack of adult providers who want to be a part of this clinic or who want to help us really take care of very unique and complex issues from our patients. So that is a lot of the work going on in the background, is how can we really connect to hospitals that are connected by a bridge, but not really in many other ways, and help make that connection better for our patients.
Do you have any dental component with the medical side? Because we've also had issues with that.
Yeah, this is a great question. I'm going to let Dr. Eckenrode answer this because she has been really passionate about working to solve that issue.
Yeah, this is a very important issue, and it's difficult and complex because it is a little bit insurance-based. Unfortunately, for adults with Medicaid alone, there is not dental coverage, and so that is what it is. We're trying to do some advocacy on a state level to try to change that for young adults with disability or medical complexity, but that is a bad thing. So we do work with the Sparks Clinic, and you may be familiar with the Sparks Clinic, and maybe not, but the Sparks Clinic is a clinic that specializes in seeing patients with disabilities, and so they will do a lot of routine dental cleaning and kind of small in-office procedures for our patients, and they will see patients not just up to age 21 but kind of beyond that. So we have a good connection with Sparks Clinic, and then I have worked with Dr. Powell. She is an oral and maxillofacial surgeon. She works at UAB and at Children's. She sees patients in Hoover, and we have kind of worked together to where she has seen a lot of our patients in the STEP clinic who need more complex dental care and surgical care, and who will need to go to the operating room for kind of routine cleanings, that sort of thing. So we are trying to build kind of connections. Dr. Powell has been great. I have several of my patients who have seen her and had good experiences in sort of more complex procedures requiring anesthesia. So the answer is we're working on it, and but yes, we do have some dental resources that we can connect patients with, and it is somewhat insurance dependent, which is unfortunate. But we also do have some dental resources for patients who do have Medicaid as well, and can kind of help with that. But it gets a little complex if you need sort of anesthesia and operative care for your dental needs. But it's a major issue that we are aware of and kind of working on, and have made some progress, and there's still some to be made.
Just a question. Is this a program like a primary care clinic? Maybe I'm misunderstanding, because it sounds like you just meet on Wednesday mornings, and I'm just thinking, okay, so if my kid or adult is sick on a Thursday afternoon, what happens?
Yeah, such a great question, and we get that from every patient and try to clarify that at all the initial visits. So as I mentioned, a lot of advocacy and strategic planning and a lot of work on the front end to get this clinic up and going is how we really got started. A lot of our funding actually was really pilot grant funding. We're really lucky now, 2 years into the grant, that the hospital system is really seeing the work that we're doing and taking over a lot of the background costs, which is great for our future sustainability and so important. And so at the start, really, we had only the support to open as a Wednesday morning clinic, but as Beth mentioned, we're busy. Open a clinic like this, and people are coming and spreading the word, and so we are very busy and looking to expand. As Beth mentioned, we have really positive buy-in to hopefully open a Wednesday afternoon clinic starting in September is the plan. And so I think more down the road, our hope is that we'll continue to show this need and continue to grow, with the ideal future plan being that we would be open to all of our patients 5 days a week. Unfortunately, that will just take time to really show the health system and continue to show that need on paper. So what we offer certainly is within the wheelhouse of primary care. We both are primary care physicians and take care of a lot of patients in separate clinics in primary care. And so what we'll tell our patients usually is if you want to seek really a primary care preventative visit with us on a Wednesday morning, obviously we'll handle all of your primary care needs, but what we're really careful and what we try to do with each patient is make them really aware of that from the start and make sure that we have a plan for what happens if you have an urgent complaint or an emergent issue come up on any other day of the week. So the most amazing resource we have is at Beth, and that number she gave to you is available every day of the week. And so we tell our patients, really, no matter what day it is, what comes up, call Beth. She can always communicate with me or Dr. Eckenrode any day of the week. And we always look to really, in any urgent situation, figure out where the best places to go.
what we usually recommend to our patients at the start, and what we find most patients have, many of our patients already have like a community or local doctor or urgent care person that they know they can go to for the random things that come up, like you mentioned, like on a Friday afternoon, I have an earache, who can look at my ear type of thing. And some of our patients would prefer to just use our UAB urgent care, which is across the street. It's staffed with some really incredible doctors who know about the work we're doing and can see the charts and know that you're a patient of ours. So it looks a little bit different for every patient, but my hopes and dreams are that we'll eventually be able to be a 5-day-a-week primary care clinic. And in the meantime, it really comes down to what works for you. So some of our patients on the flip side might see us just once a year to help look at the overall big picture, coordinate the visits with the subspecialist, meet with our social worker, but we may connect them to a primary care doctor out in the community who handles really like the day-to-day or week-to-week medication refills. And so it really just depends on what is best for you and your family, how we set up what that looks like. But as far as being available every day of the week,
I wanted to speak to that too, because I do full-time primary care outside of the STEP clinic, and I understand that kind of fear. I think it's worked out really well because we can do a lot over the phone, so we are available kind of throughout the week, and if there's an issue that arises, typically we can handle it over the phone. Like Carlie said, if there is sort of an urgent issue, UAB urgent care is excellent there. Providers are wonderful. They do have all the access to the chart and everything. But like I was talking about when I introduced myself, it's so individual. So I actually see someone in the audience who we had kind of just a one-time visit in STEP clinic, and we kind of talked about specialty referrals and sort of more kind of some of the social work stuff. But they already had a great primary care doctor, and so just kind of remained with them. And I would say we have a lot of patients who are coming from very far-flung places and kind of want to have a local physician and want us to handle kind of some of their more complex issues and then communicating with their specialists and things like that. So it's just so individual, and that's kind of when you have a first meeting with us, we kind of talk about your needs, your concerns, and what you would want this to look like. And then sometimes I'll see a patient who may be able to be seen just in my regular primary care clinic because they don't have a ton of, let's say, social work needs or something like that. So I definitely will see sometimes patients in STEP clinic and then say, okay, well, I think, we had this good comprehensive first visit here, and I can then just see you in my regular primary care clinic, and I have a little bit, I have 4 other clinic half days that I do primary care, and Dr. Somerville also has a couple of days that she does primary care outside of the STEP clinic as well. So it's very individual, and we, I think, partner pretty well with outside providers, and that's one of our goals kind of moving forward is partnering with primary care doctors across the region to teach them and have them become more comfortable in caring with patients with disabilities so that, if you live in Lower Alabama, for instance, like you can feel like your primary care doctor there kind of is comfortable taking care of you if you're a patient or your child.
Yeah, one other exciting piece about that is UAB is actually really working hard to set up like external consultations where doctors around the state can consult based on specific specialty needs, and we are going to be a part of that system. So really, again, trying to make ourselves available with our resources to other physicians around the state, because we know that the 2 of us in one clinic half day a week, we can't care for everyone in the state who so needs these resources. So a lot of our work moving forward too is how can we educate the next generation of medical residents and providers so that when they go out and work in the community and do primary care and go back around the state that they are comfortable, and then we're more available for really consults to help with really complex situations and then have access to our incredible social work team.
I'm wondering if you have a psychiatric behavioral component as part of the STEP clinic and GI as well. And then secondarily, kind of what you were talking about, the success you have with consulting with doctors locally for someone like me who doesn't live here, in terms of some sort of connection and collaborative effort. I don't know how that normally plays out and how open you are to that.
Yeah, great questions. You guys have all the hard ones for us today. GI specifically, we have a lot of partners in GI. There are a lot of gaps though, and I'll be very honest and always am that nutrition for our adult patients has been a huge gap. It's something that we're really actively exploring how to make that better. And many of our patients, we actually recommend to keep their extensive nutrition resources at Children's if that's where we're getting them, because it's been difficult to identify really that equal or better nutrition component in the adult world. But we have a lot of good data around that and are looking at that as a huge piece of our future growth with the university. And then I think mental health goes kind of hand in hand with that. There's a huge need and a huge gap across the state for everyone. And that's really just unfortunate within our state. So we've also been working really hard to quantify what is that number, what is that need. And our real hopes and dreams for this is to advocate to have our own mental health provider and clinic with us in the future. So that's really been a conversation from the start. In the meantime, it's really, again, like a lot of it is based on insurance and where you live. What I can promise you is that Dr. Eckenrode, myself, Beth, we are so committed amongst our team to trying to find anything. I mean, sometimes we have our social workers just cold calling psychiatry practices in various areas of the state. I mean, so what I can tell you is there's a lot of barriers and gaps across the state and so many resources, but this team is so committed to doing what we have to do to try to help find any resource that can help you.
And I guess what I would say is that we do address a lot of mental health issues in our clinic, and feel very comfortable doing that. It gets a little bit more complex for patients, let's say, with autism who are nonverbal or kind of a little, but kind of anxiety, depression, which we have seen a lot in our patient population. We feel pretty comfortable managing and do a lot of that. We also are able to kind of consult our psychiatrists at UAB to help with some more complex cases as well. And so that is something that we do offer a lot of just primary care mental health stuff in our clinic. And then we've also had some success, kind of depending on needs, working with our palliative care nutrition program. So I've had several patients who have had good experiences working kind of with their nutrition, but it is definitely a gap that we want to fill, and it's a very significant one. But we're looking kind of as we receive more funding to hire nutritionists, but that's just a huge Achilles heel.
And then I think the other positive, I mean, the benefit of us being med peds and we work at Children's and we both work at UAB is that really we have access to incredible resources. So there are so many, there are GI doctors and psychiatrists at Children's who we have their numbers, we'll call them. I mean, really a lot of what we've done has been able to at least make good connections with people who are always willing to take our calls and answer. And again, I mean, really just go that extra mile to call those people and see what we can come up with all together. And I think that's one of the beautiful things about having UAB and Children's in Birmingham for our state is that really people have just been so collaborative and want to help. And so we all know there's a lot of gaps in resources. And then I think that the next big piece of it is how can we advocate all together to the system and the state to have more accessible resources.
Good morning. I'm Lisa Dickey, and this is my daughter Rachel. Just want to tell you a little bit about our experience. Rachel had already graduated some docs from Children's, and so there were a couple that were already seeking at UAB. But then it came time to got on a general doc. And at that time, the STEP clinic wasn't in existence. And we found a wonderful doc at UAB Collins. It's a little easier parking, getting into, it's not quite as crowded. And Rachel really bonded with the doc there. And then I had a friend tell me about the STEP clinic. Well, now she loves Dr. Eckenrode. That's for another pediatrician. But we kind of split the gap. We see Dr. Eckenrode for referrals, and when you need paperwork, when your Medicaid is up for recertification, and your social worker's like, you got to sign on it. These guys are great. They get it done. All the social workers talk about, oh, you're at STEP clinic. This is going to be great. They'll have it to you by the end of the week. So that has been a huge help. And also, when you're reaching out to these docs, UAB has a portal system. It's called the UAB portal. You sign on, you can directly message any of the people you see sitting up here, and they will respond. And it is wonderful. It's almost better than a phone call, because you don't have to wait to ring back. You just go and, but you sign up for it. Is it through, I can't remember if you get a number from UAB. It's been so long, I can't remember exactly how to do it.
Yeah, they email you a link.
But when we started at the step clinic, to me, I was able to catch a breath because I wasn't being the doctor anymore. I could actually be a mom, share what was going on, and not having to plan, okay, I've got to call this doc, I've got to call that doc, I've got to get this together. So that was, a step back for me. And also, as Rachel's, she just turned 24, we're wanting to get her more independent and get the support personnel that work with her more familiar with all the things involved in charting the life course and things like this. But our experience has been really good. We even actually had to have an emergency surgery through UAB during the height of COVID to repair a shunt for hydrocephalus. And it was very scary. It was the first time any of that had ever happened, and they were absolutely wonderful to us. The ER, he's done a little work. I worked at UAB for 18 years, so yeah, I know. But they do try to have some systems, and I know there's some notes on right, because it was even mentioned last time when we were at ER, oh, here's the step clinic notes. So, even little things like that help so much. But I thank you guys for being such a great resource.
Any more questions or comments? Okay.
So obviously transitioning into adulthood is complex and very time consuming. There are a lot of changes. And one of the questions that I would have is, as we see those in both pediatric settings, what is the best age range or time frame for us to advocate for them to contact you?
At step clinic specifically? Yeah, that's a great question. So like I said, we see anybody 18 or over, and as Beth mentioned, it's about probably a 3 to 6 month wait for new patients. Certainly things happen and people cancel, and we do our best to try to schedule people in and fill those gaps, thanks to Beth's help. And some of this is very patient dependent and family dependent, depending on your situation and what some of your specialists at Children's are telling you also. We try to be really respectful that some of our pediatric specialists want to keep their patients until 21 and are not ready to make that transition yet. And so certainly as early as 18, we can see anyone. And so for some of our families, we're already getting calls at 17 saying, when can I make my appointment? Let's go ahead and get it on the books. We're ready to make that transition. We're done with Children's and ready to move on to an adult group. And then for other patients, it can be, in your 20s. And some of our patients now, because we're new, are transitioning even in their 30s as they hear about this resource, just to see if there are other services that they may not have heard about from their community doctors. And so certainly we'll see anyone 18 or older. And really, I would encourage all families to be thinking about that with their pediatric providers. Really what we recommend as early as 14, but a lot of work needs to still be implemented at Children's and in that system for families to be thinking about this well in advance.
I just want to make a brief comment. I'm probably loud enough, but so everything about what we do in STEP is based on an individualized plan. And so kind of to answer your question about if you don't live in Birmingham, how do you get the same resources and all of that? There's just two things I wanted to mention. So again, everything's based on an individualized plan. So one of the goals that we set with families is an emergency care plan. So, when do you go to the urgent care? When do you come to the UAB ER? When do you still go to Children's ER? What does that look like for you individually? And so we'll recommend to families that you can keep a foot in both worlds until you feel totally comfortable making that move over. And so from a system level, Children's and UAB are both collaborating together. And so what we've worked hard to do is to find a champion within every division on the pediatric and adult side that we can put those champions together and say, okay, for this patient, what does transition look like? And that's where Dr. Somerville and Dr. Eckenrode have been so wonderful, because they also have a foot in both worlds. And so those are their colleagues on both sides, and they can really say, you know, on this particular patient, what does this look like, and let's put all the pieces together. The second part of what we're doing is working through a grant through ACDD on improving access to care across the state for people with disabilities. And so how can we leverage off the success of the STEP clinic to make sure that we are working with the other places throughout the state and sharing the information that we're learning. And I think that's really critically important too, that we become, you know, kind of a hub of resources for everybody across the state to you know, really have and learn from as well. And like Dr. Somerville mentioned, through that e-consult model where any physician across the state can get in touch with us, and they can, instead of having to sit on hold and which specialist in GI is it that is good for this diagnosis, they can go directly to us, and we've already mapped out who all of those specialists are that we're working with, and we can kind of grease the wheel. Because like you guys, you know, somebody mentioned the emergency department. UAB is a really big system, and it's great, but it can be very intimidating for families of like, where do I call, and who's the specialist for this, and what do I do? And so I feel like that's where the STEP clinic is kind of on the back end, paving the way of making those contacts and you know, opening up those resources. The last thing that I wanted to just mention, hearing everything the panel said, in the emergency department, the other piece that we're now doing is adding in a part of our medical record what our recommendations from STEP to the emergency department. What do we want the emergency department to know about this particular patient? It's very patient specific. And then Beth is working on an ID card that can fit in our patient's wallet that has things that we would want an outside emergency department to know. So we're really trying to approach it from three ways, where our system will flag the emergency department, hey, this is a STEP patient, and this is how you get in touch with the STEP team. And when appropriate, a caregiver should always be allowed to be with this patient. And so that is hopefully to solve one issue in the emergency department. The second is to have the care continuum piece filled out for each patient, where anything that we would want the emergency team or inpatient team to know about the patient and the way that they can easily get to us is listed there. And then the third way is that the patient themselves will have a card in their wallet that again points back to the same information. So we're hoping that by those three ways that we're definitely improving the emergency department process and some of the stories that we've heard about how challenging that can be. All right, anybody have anything else? That takes us right to 9:30, which is when our break starts. And so I want to give everybody time again to go grab some breakfast. We have about a 15-minute break, and then we'll come back for the physical therapy session.